Service Committee meeting for Wednesday, July 13. First thing we're going to do is public comment. Is there anybody in the audience that would like to make a public comment? Since I see none, we are going to move on to consent items. Can I have approval of the agenda?
So moved.
Support.
All in favor, say aye.
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 Same side for no. Can I have approval of the proposed minutes from June 8, 2022?
So moved.
Support.
All in favor, say aye.
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 Same sign for no. Okay. Action items, none. Discussion items. Environmental health tick surveillance program, Matthew Cowan, Environmental Health Supervisor, Ottawa County Department of Public Health. Is it true you got 100 ticks with you this morning? And
Dangerous ones too.
yeah, okay, yeah.
I brought some, I can pass them around. I got about 3 of them here.
Ew.
Livening up these committees.
And then this is one of the more dangerous ones in here that we've captured.
Oh, yeah. I like this guy.
Always got a little prank.
So the ones that you're looking at right now are ones that we've captured. The one this year, the ones that are in the big jar with like the hand sanitizer type alcohol are ones that we've captured in years past and just kind of used for demonstration purposes. But you can see one in the second one that's coming around that's engorged, that's been on somebody and has eaten. So if you guys don't kind of swat at your pants legs and scratch your ankles during this presentation, I haven't done my job right. So we do, we call it vector surveillance for mosquitoes, ticks, different things in the community that can transmit diseases. So that's what the vector is. And so we do tick drags throughout the summer. We do mosquito trapping throughout the summer, and that's all part of a grant with the Michigan Department of Health and Human Services that they provide this equipment to us. For ticks are kind of the more popular one because we do have cases of Lyme disease in Ottawa County that have increased significantly in the last 5 years. So
80%.
380?
100.
180% in the last 5 years. So it is becoming more prevalent. People are outside more. The ticks that we capture, there's different species that are here. So one of them is just your kind of general dog tick, which is kind of ubiquitous throughout Michigan, and it is it's not a prevalent transmitter of disease. It can in certain scenarios, but it's not one that's a high concern or a high risk. The other one that we do find here, not nearly as many numbers of, are the black-legged tick or the deer tick, and that is what transmits Lyme disease. It can transmit other diseases as well. So we have found several of those in northern Ottawa County at different parks. So we do collect them, catalog them, and then we can send them into the state for identification as well, just to confirm that we found what we think we have. One of the more interesting ones that we have not seen, but that we are looking for, is called the Lone Star tick. And it can transmit diseases as well. One of the interesting things about that is that it can give you an allergy to red meat. So you get bit by it, you get an enzyme, and you have an allergy to red meat. If you're like me,
You said that you haven't found any around here.
we have not found any of the Lone Star ticks here.
Okay.
We did have one that was sent into the state in June that was from Spring Lake. A family in Spring Lake found a tick on their dog, sent it to the state to be identified. It was identified as a Lone Star tick, but they had significant travel through California, Indiana, Ohio. So it was not believed to be from here.
Okay.
Kind of the follow-up to that, the public health aspect of that is that, so we get notified that they found it. We have that information. Probably 3 or 4 days later, our public health surveillance group, which monitors transmissible diseases, sent an email out that somebody at that address had Rocky Mountain spotted fever, which is a tick transmitted disease in a young girl. And that's who was in contact with the dog. And then they also had probable symptoms in a son that was 3 years old as well. So that kind of completes the public health circle of surveillance, tracking, and then having, that the disease identified. And it's not communicable between people, but it certainly is with ticks that are present. So, and then we do mosquito trapping as well. And it's really, really hard to get those little traps that grab onto their legs because they're so small. But we do have, they're big traps. If you're out and active in some of the county parks, we do it all across the county. They're big kind of collapsible nylon containers, and they do emit a scent or a bait that we put in to target a specific mosquito. We're trying for Aedes aegypti is the specific mosquito because that's a disease carrier. And they like suburban areas near industry. All of these mosquitoes kind of have a specific area that they like. And so we try to set these up in parks that are near like junkyards or scrap yards or different areas that might be transferring material from in and out. So these scrap yards will buy, or junkyards will buy cars from Indiana, Ohio, Southern Illinois, bring them up here and sell parts for them. So those things can have pools of water. They can have, different things like that these mosquitoes can live in. So we try to target these areas. So we have kind of an early warning or advance notice of what we found, but we have not found any mosquitoes like that this year.
Back to ticks.
Yes.
Okay, this is my 10th year on this board. Dr. Heidel, I remember the first couple meetings we had in the summer of that year. He was talking about ticks, and that was all new to us. And he said, what we're finding it, and they were getting information from the veterinarians that they found it on dogs.
Right.
Okay, and he said most of them were coming west of 31. Now, okay, 10 years later, what are you seeing in the area wise of ticks?
Yeah, 10 years ago, we probably wouldn't have found any deer ticks. They would have been farther south maybe along the southern border. And that first row of counties. But now, yeah, we found 3 of them up in the northern part of Ottawa County. And that's just, so when we do our tick drags, we have a white piece of canvas that's about 3 feet wide and about 4 feet long. And we just walk down the trails in the parks. So it could be through dune grass. We did some at Grand Ravines. We do them, all throughout the county. And it's, you walk in about every 20 or 30 meters. You have to drag it 1,000 meters. So every 20 or 30 meters, you stop and you pick the ticks off it, put them in a container, and you keep going. So it's areas that people walk. We're not walking in, grass that's this high. It's going down trails. So we are finding stuff or, ticks that we found that we wouldn't previously have found.
But they're getting more and more out there.
There are, yep. And I think our Lyme disease cases would confirm what we're seeing in the field when we see an uptick in what we catch in the field, and it's corroborated by an increase in Lyme disease. It's a kind of confirmation that it is increasing, and we're seeing more than we have previously.
On that test that you're doing 1,000 meters, how many ticks are you normally finding?
Yeah.
It depends. So it's been so dry these last 3 or 4 weeks that we have not found a lot. Ticks are more active in their juvenile stage. It's called a nymph. And so they move around more because they spread out. They're trying to find a host. Once they're to an adult stage, they may have already fed. So they're not terribly active because they're good for a while. So we tend to find more in May and early June. And then when it gets hot and dry in June and July, we don't find as many. Then we'll get another uptick towards the end of August and September. So, but we found 55 on one drag.
Wow.
Last year. Our numbers haven't been quite as high this year because it's just because it's been so dry.
And then the really little ones, like those really little, how do you notice those on you? Or like
It's tough.
Do they actually bury their head on?
They will. Yep. Yeah. At that age. So it's a lot of times people won't notice the little ones.
Yeah.
The state used to do testing. So if you had a tick that was on you, you could take it off, send it to the state. They'd check it for Lyme disease if it was the right species. But they don't do that anymore because they would tell somebody, oh, that was okay. But they may have had 2 or 3 other ticks that they didn't notice, right? So they might have one in their hairline or behind their ear, under their arm. They noticed one here because they see it, but people had kind of a false, oh, I'm going to be okay, but they had other bites that they didn't notice. So they're hard to notice. The recommendations that when we talk to people, all deal with prevention. So kind of long pants, DEET repellent, so off with DEET is going to be the most effective. Light colored clothes, so you can see them crawling on you. Tick checks, after you're, if you're outside in the yard, in the brush, at a park, to come back and check yourself.
Is there any like shampoo or anything you could use to like get them off you, or is there nothing?
There's not an insecticide type of shampoo like you would with lice or something like that I know of. It's all kind of physical removal.
If you got a small child and they got one in their hair, you can
Right.
see it
Right.
what's the best way of taking it out?
It is to take a pair of tweezers
Yeah.
and to get down right at the base of the head, right by the skin,
Yeah.
and to pull it out very carefully. And then
Straight up.
straight up, and then
Okay.
monitor that area, because what can happen is that the head breaks off and gets left in there and can cause an infection. So to kind of monitor that area. I will say a tick has to be embedded for 24 to 36 hours for it to be able to transmit disease. So it's not like it bites you and you got whatever the tick has. It takes a while for that process to occur. And generally at that time, they're going to be noticeably bigger than what they were in some of those small vials, which isn't comforting.
Check pets too, because a lot of times pets
Pets.
bring them in the house.
Yeah.
Pets can also.
Yes, yep, yeah, pets can be susceptible to it as well. Yes.
180%, what does that actually, like in terms of number of cases? How many people a year are we talking?
I think we're probably around 25 total. If on our, I know back when I did an interview with WZZM back in May,
Good.
we were at 11, I think 10 or 11 year to date, and we hadn't reached the busy point. June, July, and August are generally when the numbers go up faster, because that's when people are out and about. So 20 to 25 would be the.
The 180% was in our annual report, and it was last year's number over the previous year. So I can get you that information.
Okay.
I'm just
Yeah.
curious.
And I think over a 4 or 5 year period, I think we've gone from like 10-ish, 8 to 10-ish to 22 to 25,
Okay.
21 to 25,
Well, I
somewhere in
mean,
there.
I even hear people, kids got ticks on their house,
Mhm.
and they were playing under a pine tree.
Right.
Because there's certain areas they like to be more than others.
Generally tall grassy areas are going to be where they're at, where there's a lot of leafy vegetation. Right now, because things are so dry, we're finding them in leaf litter areas. So we'll drag a park through the grass and we won't find anything because the grass is tall and dead. Then we'll do another drag through under some trees and through the leaf litter, and we'll find more.
So it's not like they're gonna fall on you.
No.
They're
They're,
usually on the ground.
they're very much hitchhikers,
Yeah.
right? Like they just hang on somewhere and they wait for something to pass by, whether it's a deer, a dog, a person,
Okay.
anything.
Matthew, and maybe Lisa can answer this better, treatment for Lyme disease.
Generally, it's antibiotics. So if you,
Quicker or the quicker.
right,
Yeah, and that might be a really good question for Gwen. You want to chime in here, Gwen? There's antibiotics, and what's the timing around when you'd need to be treated?
Right, so there are some cases where it is recommended to actually start taking an antibiotic before you get symptoms of Lyme disease after you've had a tick bite. Those are situations where you have to meet a certain list of conditions in order to really have a high enough level of concern to get the preventive antibiotics. Once you have the signs or symptoms of Lyme disease, which can happen actually anywhere up to about a month after a tick bite, it's usually a 2 to 3 week course of pills, usually doxycycline, which is a very common antibiotic. And that usually takes care of the symptoms. Sometimes people can have some symptoms that linger a little bit longer than that, but once you finish the antibiotic, the infection is cured.
Gwen, talk about some of the long-term complications if untreated.
So this is an area that gets a little bit confusing for people. If Lyme disease is not treated, it can cause long-term problems like different types of arthritis. It can cause heart problems. It can cause really just vague symptoms that can look a lot like other diseases, infections, chronic fatigue, things like that. That is typically, though, if you don't treat the infection. Once the infection is treated, you no longer have that infection. And so sometimes people will talk about something called chronic Lyme disease. That's actually, it's actually a misnomer. Chronic Lyme disease is not an issue if you've been treated with antibiotics. It's more if you don't get treatment in those initial stages that you can have those complications. Does that make sense?
Thank you.
And if you were bitten by a tick, and that you can bring it to our office and we identify them. So we can identify it, as to whether it's a disease, a species that carries a disease like that. And if it is, then you can monitor your health, you can monitor that area. Classic Lyme disease would be what's called a bullseye rash at the spot of the bite, where you'll kind of have a red spot right at the bite, and then a area of kind of whiter skin, and then another red spot around it. So it looks like a bullseye. Fever and chills, typical symptoms for that you would monitor. And then at that point, you'd want to go see your physician.
Matt, once a tick crawls on you, is there an average amount of time when they crawl to when they bite? Is it like within a minute of them getting on you?
No, they can be on you for hours before they bite. Yeah. I mean, they're making their way. They don't move fast. And they're making their way somewhere, because generally they have to go over clothes and to skin to find whatever, I don't know how they know where they want to bite, but yeah, it could be hours that they're moving around on you. So it's not like they're on you and then they attach right away.
So you'd have time to
Yep.
do the tick check
Yes,
after
yep.
a long hike through the park.
Yes. Yes.
What's generally the percentage of ticks that have like carrier disease?
That one I don't know the
good
answer
question.
to, because we don't test them so much anymore. I mean,
Yeah.
it used to be that you would send the deer ticks in and they would test them, and you would say, oh, well, we sent 10 in, 3 tested positive and 7 didn't. So you could get a number, but I don't know what that is since the testing stopped.
Okay, is it generally kind of high or is it kind of low?
I would probably say it's on the lower end of the scale, just from reading stuff. And just because one has it doesn't necessarily mean that it's going to transmit it
Huh.
either. So there's a lot of factors that go into that.
In Michigan too, you should know it's not just exclusive to our area. I
Right.
think Al, you mentioned that the lake shore,
Yeah, it used to be big on
Yeah,
the
it
west
is.
on 31, and now it's,
it kind of started on the East Coast and then just keeps moving this way, and they like to be along the lake shore. And so if you look on MDHHS or maybe
Right.
one of the environmental agencies at the state level, you can see the map and it's bright red all the way up the coast.
okay.
And a lot of that is from out of, as we talk about the one family that had the Lone Star tick in northern Ottawa County, people travel, right? So you get a lot of influx of travel from people that are outside the area, and where this is a normal occurrence. They travel, they bring their dogs, they bring, everything up here. And like I said before, those ticks are hitchhikers. They come along, they drop off, they don't ever know that they had it on. And that's one way that they spread.
You're going to talk a little bit about the mosquitoes in West Nile and.
Right, yeah. So the mosquitoes, we haven't found any of the specific targeted mosquitoes species that we're looking for this year. Years past, you might find 1 or 2 that we would send in and they would identify them. It's been a pretty slow year for mosquitoes because it's been so hot and dry. So when we go out and trap, we might only catch 10 or 12, where, in wet years when they're really abundant, that number might be 70 or 80 that we go through and identify then. So mosquitoes, the drought or the dryness certainly has affected the numbers of those. So,
Do we have any of that horse mosquitoes?
And stuff like.
yeah, Eastern equine
Yeah.
encephalitis, the triple E. Not a lot. Most of that has been found south of Ottawa, and the state, so the state, because you can target different species. So based on the bait that you use and where you set the traps, and the state doesn't let us trap, or they don't provide the materials for us to trap for the Eastern equine encephalitis, because they haven't identified it this far north. So Allegan does, Kalamazoo does, some of the southern counties do. And we had a call about a week and a half ago with the whole mosquito group that does it statewide. And I don't think any of those had found any at that point.
And maybe Gwen remembers this, but didn't we identify something in Kent County just within the past few days? Am I having a pipe
Yeah.
dream here?
West Nile.
Oh, that was West Nile,
Yes,
okay.
yep. And West Nile is one that at this point it's found almost every year here. So it's not 10 or 12, 15 years ago when we would find West Nile. It was new. We hadn't dealt with it before. Now it's something that's generally found almost every year here. So that's carried by a different species than what we're looking at.
It seemed like we always heard more going into August and September of that. Is there a reason behind that, or?
And so with the Eastern equine encephalitis, the triple E, that's when there's a lot of school activities that are in the evening. So the football games, and that's when mosquitoes are most active, or at
Okay.
dusk. And so there were a lot of activities that occur, 7 to 9,
Okay.
which is a prime time for mosquitoes to be out and about. And the Eastern equine encephalitis is a much more severe disease, and Dr. Nguyen might be able to touch on it. But the progression that it takes, once it reaches, like if you actually get to that point, I think the recovery for it is in the low double digits in terms of 10 or 12%, 15%. And those that do survive generally have long-term kind of neurological deficits and require a much higher level of care. So it's a much more severe illness than the other ones can be.
Any other questions for Matthew?
Just a follow-up, there were 28 cases last year. So. And then according to a Google search, which I don't know if this is a reliable website here, Kyle, but it says typically about 20 to 25% of nymphs are infected and about 40% of adults are infected. Doesn't give me a year. This is in Southwest Michigan.
Okay.
So that seems a little high to me, but yeah.
How do you get tested for that kind of stuff? Is you just start feeling sick? 'Cause I've had a lot of
Yeah.
ticks on me.
Yeah,
last year.
Lyme disease is basically physical, like you see the bullseye rash, you get fevers and chills. And if you come in with a classic case of Lyme disease, they often might not even do like a blood test or something, because the physical indications are accurate enough for them to do that. If you came in and said, I've got fever and chills, and I pulled a tick off me, then they might do a blood test at that point. But a lot of it is based on that identification of the tick. So yeah, so I would recommend if you have a tick on you that is engorged, it's been there, put it in like a Ziploc bag, and you can bring it by our office and we can identify it. And that goes for general public as well. So we have people that bring ticks in all the time. We had some that come in that'll be so big that we'll send an email out to the public health staff, and people from the other side of the building want to come over and see it because it looks like a giant blueberry.
Yeah, seriously, it's amazing that tiny
Yeah.
little bug just, well, I mean, that was an exaggeration.
Yeah.
Just talking about it here, I feel like I want to itch
Right.
somewhere,
Well, then Matt did his job,
Yes.
right?
Right. Yeah, but the message goes back to prevention. That's the best way is, light colored clothes, long sleeve shirt, long pants, and plenty of off, because that will help keep them off your skin.
So Matt, while we've got here, Matt
Mhm.
also oversees all of our septic
Septic.
and well and all of that stuff. If you have any questions, I think they've been really busy.
We have
Business is continuing to boom with new
Yep.
builds and.
still brisk, yeah. So our new permits are still, we saw a bit of a pause in February, March as everything was changing, but there's definitely a backlog in terms of new homes that are being constructed. So our permit numbers still continue to be strong. Our real estate evaluations have dropped some because interest rates are up, and I'm sure you're seeing that in the market as well. So our real estates,
You're still making the 10-day.
yes, yep,
I
yeah.
had a use last year, and I think it was 3 or 4 days, and I got contacted that they were coming
Right.
out.
Yep, yeah, generally, I mean, real estates we're probably contacting. I know we had one that came in on Tuesday and came in on Monday. We did the inspection yesterday. So
Okay.
our real
Yeah.
estates are
Yeah.
are spot on, and our permits, we're closer to the 10-day turnaround time for permits. Just because we often have to wait for information so they'll put an application in, we'll contact them, and they haven't given us, house plans or blueprints or, where it's actually gonna be. So we might get a little closer to that, but it is, yeah, we've been very, very busy.
Thank you.
Matt, with the real estate septic
Mhm.
inspections, what do you do?
What do? We crush hopes and dreams. No, no,
We
we-
gotta stand on our
the-
head.
If they pulled
No.
the cover and stuck their head in there.
No, so
around, or-
with the real estate,
Good job.
yeah, the first thing would be to say that the real estate isn't made to bring things up to current code. So we pass things all the time that don't necessarily meet current code if it was installed today. So it doesn't have to meet current code to pass, but the delineation is that it can't be a health hazard. So when we do a septic real estate, we go out based on what kind of records we have in the file that we look at. We'll locate the system, measure it, see how big it is. And then we do a boring into the drain field. And when you bore into a drain field, in a properly functioning one that's in good shape, you want to see nice, it doesn't have to be clean or necessarily dry, but you want to see stone, that stone that's in that drain field should look natural colored. So you should be able to see kind of the blues and the browns and the grays and the greens of that stone. And that indicates that the system is operating as it was intended. What you don't want to see is black sludge, standing water, things like that. Because as a septic system fails, it kind of seals off the bottom just because there's so many nutrients and bugs. It seals off the bottom of the drain field. And over time, then that effluent kind of builds back up like a toxic swimming pool. And so you can bore down into them, and we bore through and we take a look at the sand underneath them to show if there's been any indication that, that it's been overloaded or had issues in the past. So we can give a pretty accurate kind of evaluation of what that system looks like. We generally do two borings into each drain field, one in the front of the drain field and one in the back, and evaluate it at that point. One of so if it's full of sludge, which in our case, a drain field is stone is generally 12 inches thick. So we would say if it's over the level of the pipe in the black sludge standing water, that's about 10 inches. That would be considered a failure if both borings were like that, because it can't accept it. It's going to back up into the septic tank and into the house, and you're not getting any treatment in the drain field. And the other failure for it would be sizing, if it was too small to serve the house, or if it's installed in the water table. So if we permitted a new house today, we would do our boring in the soil. We'd identify where the seasonal high water table is, and that fluctuates seasonally, but it leaves marks in the soil. And we'd stay 2 feet above that. So our real estate, it can be within that 2 feet from the bottom of the drain field stone. But if it's in the water table, then you're not getting proper treatment there, because sewage requires aerobic air or oxygen conditions in the drain field. And if you have groundwater in it, that treatment process stops, and all of that contamination is in the water table, and it doesn't change at that point. So that's a septic system evaluation. A well evaluation is similar. It's a physical construction, what it looks like. There's different vents that are on them. We make sure that those vents are screened, because you can get insects and rodents and stuff like that climb up into the well. We do water samples, and we check for isolation distances to sources of contamination. So to septic tanks, drain fields, fuel oil tanks, and things like that. Probably, I know in 2018, we came before the committee and the board and we revised our real estate policy. And we made it more, I don't want to say sciencey, but we made it more adaptable. So we used to have a, percentage rules of a drain field had to be 75% of current sizing to pass. And we altered that. We made it a little more lenient. So we did 100 square foot per bedroom for a drain field. So a 3-bedroom house would have to have 300 square feet of drain field, which is, it's an undersized drain field, but if it's in good shape and it's functioning, there's not a reason that it can't be kept for that house and it meets the other stuff. For wells, we started looking at the geology. So if a well is, too close to a sewage lift, and normal isolation would be 50 feet. If it was, let's say 25 and it's from a sewage lift, we would look and see if it passes through a clay layer. So if the well is 100 feet deep, it goes through 25 feet of clay, the sewage lift isn't going to pose a threat to it. So we kind of made it a little more lenient, more adaptable to accurately assess the environmental hazards of the systems that are there.
Brought up the water table.
Yes.
Is there public information as to like a specific address, what the water table is? I'm gonna sink a well for sprinkling and I'm trying to figure out, okay, do I have to drive this thing 100 feet or can I go 15 feet?
Yeah. So the well question that always comes up. What's your address? Wells by state law have to be 25 feet deep. For irrigation wells, we'll write a variance to 20 feet for that. But in Ottawa County, irrigation wells do require a permit. So we would say, get a permit. And then as part of that permitting process, we'll write down the area well depths. And that's because irrigation wells, even though you might not use your irrigation well for drinking, there could be a house right next door that has a drinking water well at that same depth, and an improperly constructed well not necessarily by you, but on your property, could impact and cause pollution to somebody's drinking water source. So if you think of of an aquifer as a cup with a bunch of different straws in it, if you have a straw that has a hole in it or something like that, it definitely can affect somebody's drinking water for it. So there's not like a website that you can go to take a look at it. There is kind of generally in the 60s and 70s, there was soil conservation work that was done in all the counties, and they have generalized maps. Their goal was to do a soil boring every acre. And then they put together kind of an overview of maps and kind of what that looked like. But that generally only goes down 5 or 6 feet. Generally, if you're talking west of 31, there's water that is, you have sand that sits on a, 18 to 70 feet of sand. The closer you are to 31, the shallower it is in certain areas, and the closer you get to the lake, the deeper the sand layer is. So it's not uncommon for there to be groundwater at 5 or 7 feet, something like that. That does fluctuate. So this time of year, I mean, even as you drive around and you see ponds that are down 5 or 6 feet. So that's very seasonal, and it is very subject to withdrawal concerns there too. I mean, we have our water board and water study, which is focused on the deep aquifer kind of in the center of the county at the bedrock aquifer. But we're starting to see seasonal concerns that have risen up in the past, not nearly the numbers that we do in the bedrock, but that water level fluctuates so much in the sand. And there's large agricultural withdrawals that are from blueberry farms, and that are needed, right? That's how they grow their stuff, but they take a lot of water out. They put it back in, right? I mean, it's a process that it goes back down, but some of it's lost to evaporation. And then just when it's so dry and everybody's sprinkling their yards, that aquifer we see fluctuate quite a bit.
Okay, thanks.
Any other?
One thing to add, it's always important to remind people that do have septic systems to take care of those by having them pumped out
Pumped, yeah,
periodically.
yep.
And I think the recommendation is every
3 to 5 years
3 to 5
to have
years.
that pumped.
I had a guy that said he was gonna put a sprinkler pump close to the drain field because he could fertilize while he's running.
Yeah.
And I said, I wish you never said that to me. Why, he says, won't that make sense? You know, I said, I don't wanna hear it, I don't wanna hear
Is that your neighbor?
it. No, it was your
You didn't
neighbor.
want to smell it.
Because Matt's gonna want to know your address too.
Yeah. No, this was a real estate, I said, no, don't even go there, don't even there. So, anyway, Matthew, thank you.
Thank you.
Okay, department updates. Lynn, Jennifer, let's start with you.
Yes, so at Community Action Agency, we are still working hard to provide our customers with assistance for our water program. Again, we have a large grant to assist individuals that are past due on their water payments. So we're trying to get the word out about that. We have about 14 months left to spend that money out. So we're trying to connect with municipalities, even like private water providers, maybe mobile home parks, to get the word out, to make sure that anybody that is past due on water, that we can try to assist them. In addition, we have a vacant position. I know that doesn't sound like a lot, but again, we're a team of 6. So when you're down 1, that's pretty significant for us. That is our weatherization program coordinator. Her last day is next Friday. She's been with the agency for 22 years, so it'll be a significant impact. The position is posted right now, and we're going to be doing interviews next week. So hoping that we don't have a large gap, because again, that person in the position now oversees our weatherization program, and we're anticipating a large increase in our funding for that program. So it's going to expand significantly. Because of that expansion, I'm also bringing to the finance committee, trying to get another person on staff. We're hoping for another intake worker to assist in our weatherization program. We're gonna have a lot of clients coming in the door, so we're gonna be putting in a request for that position as well. So, any questions?
Board fully staffed by now?
Yes.
You're all
Yep.
set for that?
We're all set.
Okay.
Yep.
Thank you.
Thank you.
Any questions for Jennifer? Lynn?
Morning. Some updates from CMH. We continue to be very busy. I know I've said that the last probably year that I've been coming in, but the dip we saw in COVID is completely recovered and then some. We continue to keep a real close eye on our provider network. Those are the agencies that we work with to help round out our full array of services. They continue to struggle due to staffing, which is related to COVID and all the last couple of years, but they continue to have problems attracting staff and retaining staff. We had a meeting last week with the department, and they let us know that the state hospital is also having a very serious problem with staffing. They are planning on closing about 100 beds in the various state hospitals throughout the state. One in particular that we use most frequently is in Kalamazoo Psychiatric Hospital. And they're planning on, of those 100 beds, 50 of those are coming from KPH. So what that means for us is we've already had an incredibly difficult time trying to place people into psychiatric hospitals and state hospitals. And losing 50 beds is just going to make it even more difficult. So we're going to work with them the best we can. Again, they're claiming, and I don't doubt them for a minute, that the reason for their needing to close those beds temporarily is because of staffing, just like what we're having. We are doing what we can to help our contractual providers and to help with that staffing problem. Over the last 2 years, we've increased all of our Medicaid rates for our providers. We've also provided over $1 million in millage funding to help stabilize primarily residential providers. And we anticipate doing the same thing going into 2023. We're staying in close contact with them. They were able to raise their rates to what we thought would be competitive rates. And of course, everybody else is raising their wages. So we keep playing catch up. But nonetheless, we continue to meet with them frequently to keep our pulse on how they're doing. We obviously cannot survive without those contracts and those community partners. We are starting some conversations with some of the community outpatient providers, those agencies that provide low or no cost counseling services. We're hoping to be able to provide some funding for them to expand their outpatient services so that we can continue to have a wider safety net of people that we're helping. And those agencies are definitely places that we do a lot of referring out to. So I'll keep you informed on that. 2 more CIT, so crisis intervention team workers, social workers were approved at a recent Board of Commissioners meeting. So that will bring the total to 4 community mental health social workers that are on that team. The 2 new ones are going to help round out the program. We're providing a lot more training to law enforcement. So these 2 new social workers will help to kind of fill in those gaps. And that's all I have, unless you have questions.
Lynn, group homes,
Mhm.
how are they doing for staffing? Struggling.
They're struggling mightily.
And this is not an Ottawa County's problem. This is a state problem, right?
Yeah,
I mean, if you got a group home up in Alpena, they probably got the same problems that we do.
it's definitely a statewide issue. It's, in fact, I would venture to say the entire country is struggling.
And does okay, you're aware of it. Okay, how about the administrators of the Michigan Health and Human Services in Lansing? Are they aware of we're all struggling with this?
Yes, they're definitely aware. We've been giving them lots of information and data about how dire the problem is. They definitely have tried to help. They have given the PHPs, pre-patient and patient health plans, and the CMHs additional funding to try to help with the wages and attracting staff. And it's still not enough.
So, I know I don't want to put you on the spot, but a group home in Ottawa County, a worker there, what are they making? What do you think they're making?
Right now, on average, I would say that they're making between $15 and $17 an hour.
Okay, okay.
They really should be making about 19.
Some of the group homes, are they privately owned?
Yes, so there's a variety of different group homes that
Okay.
exist in the state and in Ottawa County. Some are run by corporations.
Yep.
Some are individual families who open up their home
Okay,
and have people living there.
and some are nonprofits.
Yes, there are for-profit and nonprofit organizations.
Okay, so if they want to pay more, they got to pull it out of their profit. I mean, their own pocketbook. Like they could pay them $20 an hour, but the state is only going to allow so much money to be paid. Am I correct?
Well, the state hasn't put limits on wages for direct care workers, but the reimbursement is based on the money that
Okay,
we receive from Medicaid from the department.
okay, so there's a limit on that reimbursement then. So if
We
they're
have a-
paying them more, it's coming out of the profits. If it's for profit or nonprofit, it's coming out of their funds, right?
Yes.
Okay. Okay, thank you. Any questions? Yes, Jim?
You said at one of our board meetings that the new school being built behind you guys in the mall. You were gonna try and get them to do a program to put nurses in. Has that worked out at all or not?
Yep, it's still in the works. I have a meeting tomorrow to check on the status of that, but GRCC, we've been working with them to develop a pilot program for direct service professionals, sort of a credential that they can earn that provides really good training on various aspects of being a direct care worker. And the thought behind that would be those people who went and got that certificate would have a wage differential. And really what we're really trying to do long-term is create a career pathway for direct service professionals, similar to what CNAs do in nursing homes. Somebody can look at that and say, this is something I want to go into, I have a passion for, and I can make a living at it and stay there for, a long time, hopefully.
Thank you very much.
Mhm.
Okay, any other questions? Thank you. Lisa?
Would you mind if we allowed Gwen to go first? I want to
Sure.
make sure her stuff, because we've got some bat stuff and some monkeypox stuff that I think
Okay.
will be
Yep.
interesting.
All right. I know I wasn't here last month, so I have a couple months worth of disease of the month to catch up on. Matt already talked about some of what I was going to talk about. But I do have just a few updates in terms of some of the infectious diseases that we are working on, trying to spread some education about, and then also just working on our efforts to make sure that the community healthcare providers are aware of what's going on and have the resources that they need, as well as educating the community. So right now we are still keeping an eye on the latest COVID surge. Nobody wants to hear about that, but it is out there. There are a couple of variants of concern that seem to be, again, wreaking some havoc in other parts of the country. So we're trying to keep our close watch on that. We're continuing our vaccination efforts, and every little bit helps. We've been very encouraged that since the vaccine was approved for kids under 5, here at the health department, we've been filling a lot of our open vaccination appointment spots with folks that are interested in having their under 5 vaccinated against COVID. So that's been very encouraging. We've also been working really closely with our long-term care facilities, so both ends of the age spectrum, to get our folks up to date on their boosters, because the evidence shows that getting that extra booster dose of the COVID vaccine really does help to protect our folks in those really high-risk age groups and settings, like our nursing homes, assisted living facilities, and that kind of thing. So we are working really hard on that. The facilities have been great in partnering with us. We've had teams going out to administer vaccines at the locations. And then our teams here at the clinic have been working really hard behind the scenes to make sure that we have what we need, and so that we can just make sure that everyone is protected no matter where they are, whether they have to come to us or we go to them. So that's kind of where we are right now with our COVID stuff. Lisa mentioned some bat stuff, which of course is always a little bit interesting and creepy. We've had actually 2 bats so far this summer that have tested positive for rabies, and they have actually been contacted by humans. So we've had some folks that have had to actually get rabies shots to make sure that they don't end up getting rabies, which is fatal if a person gets rabies. So it's an area that we don't often think about, unfortunately, but last year we had 3 bats that tested positive for rabies, and the year before that we had 0. So it's something to keep on our radar. I guess that's kind of a bat reference. And the unfortunate thing that we've noticed is that in a few of these cases, it's been kids that have been in contact with the bats. So we're really focusing on education, basically don't touch bats. I can't imagine wanting to touch a bat when I was a little girl, but I guess that's just me. So we're working on educating for the community, especially, you know, leave the wild animals alone. We are seeing this virus more frequently, so just be very, very cautious in what animals you try to make friends with. And then the thing that is occupying a lot of our time right now is what people have probably been hearing a lot about in the news, and that is concerns about monkeypox virus, which you may also hear referred to as MPV. We don't have any cases of it in the community in Ottawa County right now, but we have had some other cases in the state. So we are trying to be proactive and trying to be prepared. If we do have anyone here in our county who is infected with MPV or is exposed to MPV, it is a rare infection. It's spread by close contact, so it doesn't spread nearly as easily as COVID does, but it is a very uncomfortable disease if you were to be exposed to it. So we want to make sure that we are prepared in case any of our community members do come down with it or are exposed to it. So we're working really closely with the state and the CDC to make sure that we're prepared with any vaccine that may be indicated. And again, this is not a community-wide vaccine. This is for those that are at high risk of exposure. Those are some very specific categories that we can get into if anyone has any questions about the specifics. And then we're working again on educating our healthcare providers here in the community to make sure that they have the resources they need in case someone comes to their office with concerns about that. So those are the things that we're working on right now. A lot of diseases for you. I hope you enjoyed all of those. I won't show you any gross pictures because they're no fun.
Gwen,
Yes.
incubation period for monkeypox.
It can be about 2 to 4 weeks, actually. And the one thing about monkeypox that's different from some other illnesses is that if a person is not having any symptoms of MPV, they will not transmit it. So unless they have the rash, the fever, some of those other symptoms, they're not going to unknowingly spread it to someone else. So that is, I guess, one silver lining in it. But it can be from 2 to 4 weeks after being exposed that someone could end up having symptoms. So we encourage them to just monitor themselves closely if they know they've been exposed.
I'm gonna slide away from.
Yeah, we do have, there are 2 cases right now in Kent County. Both have history of travel, close contact, so that gets a little concerning for us. It may seem like, oh, monkeypox is not that big of a deal, but
It is.
people probably didn't know that we were actively engaged in doing stuff with Ebola, even though we never had a case. We had a lot of travelers that we were monitoring. We had a whole system in place for testing. The same thing applies with monkeypox. We have to have a full-on plan to support our physician offices. We've got to have internal and external communications. We've already had phone calls from the community, from people that are concerned. And so we're working on that to make sure that our community is informed and safe and has access to what they need.
Could you get it, let's say, by sitting next to someone in an airplane, where you're fairly close to someone? Could that be it?
I should let Gwen do that. I would say if you were like hugging them and rubbing up against an open puck, Gwen, why don't you take that one? That would be my non-medical answer.
So it's not impossible, but it's unlikely. It's spread mostly by prolonged skin-to-skin contact, but it can also be spread via like respiratory secretions if you're up close and personal with someone. Again, it's more like if you're having a very intense close conversation or if you're engaged in some other kind of physical contact with them. But the rash is actually contagious and it can leave particles of the virus on things like clothes, bedding, towels, those kind of things. And so that is another way that it is spread. But again, it's not as easy to catch as something that's airborne like COVID.
Thank you, Gwen. Any questions for Gwen? Okay, Lisa?
So just a couple quick things and showing you our Directors Award that we received. I'll pass it around. Generally, the Michigan Department of Health and Human Services provides a Directors Award each year to a health department in the state that's done something really exceptional. We have received a Directors Award 2 times in the past, which we're super proud of. This year, in light of the statewide effort around the COVID response, they gave each health department a Director's Award for community leadership in that space. So I just wanted to thank our team for all of their hard work in that space, and we'll continue to do that. And we were notified from the state that we will be receiving close to the same amount of funding for COVID that we did last year. So we're working with fiscal services and of course, John and administration, and identifying where those biggest needs are around COVID as we go into 2023. The good news is that they've broadened the funding slightly to not just be focused on COVID specifically, but also other communicable diseases. So if we're working on things like monkeypox or West Nile virus or Lyme disease, we'll be able to use some of that funding for those other preventable diseases. So we'll keep you posted on that. We also received a $300,000 grant to, it's basically focusing on reducing the disparity among different populations in our community by bringing a group of representatives from each of the different demographics in our community so that we can learn from them about what some of the barriers that they face are to accessing healthcare. And so we'll be working with Community Spoke and some other community partners on making sure that we learn and change and take down some of those barriers for folks when it comes to access to healthcare. I think yesterday Matt mentioned at the board meeting, we're trying to provide opportunities that are a little bit more convenient for people. We know moms and dads that are going back to school with their kindergartners in the fall or going to school have some requirements that are state requirements for hearing and vision screening, oral health screening, and immunizations. And so we're having an event at the health department, and we're hoping that maybe people can do it like, going to Meijer and shopping for clothes and food and everything that they need. We're going to be able to provide all of those different services at the same time in hopes of making it more convenient for parents. I think that's all I have for today.
Thank you. Any questions for Lisa?
Yeah, Al, I have one, Mr. Reedy. Lisa, I just got a quick question. I'm wondering if you can have somebody in the office get with Department of Defense's on their website. They're posting on there that for active duty military for their shots that they can get them on all the different things for Ottawa County, but yet Ottawa's not doing apparently all of the various yellow fevers and stuff like that. So if we could just, if we're not doing one because we're sending it to Kent County, if we could maybe somehow reference that or whatever. And I can get you behind the scenes more info later.
Sure. Oh yeah, I do really appreciate that. And we would definitely do that. So I just want to clarify though, are you saying that our website is not aligning with what the Department of Defense is saying?
So DOD is actually, well, they will refer someone to Ottawa County for the shot. And then saying that they're offering it, but yet we don't have it because we don't have enough, obviously, if people asking for it and the vaccine maybe doesn't last with the shelf life or whatever. But I mean, so it's not like we're not doing anything wrong. I just want to try to make the wheel work a little bit better.
Okay, great. I love it. All right. Let me see what I can come up with. And if I have any additional questions, I'll give you a call offline. Thank you.
Okay, perfect. Yep. Al, that's all I had.
Okay, thank you, Randy.
Yep.
Patrick, you're next.
Sounds good. I'll touch on two things that I've talked about at least at the last meeting, if not the one prior to that. We continue to convene a number of community providers around the growing unsheltered homeless population in Ottawa County, which I've mentioned basically doubled from first quarter 2022 over 2021, really looking at within that population, individuals with severe mental health disabilities, substance use disorder, or victims of domestic violence. And so we've been meeting monthly and looking at some kind of long-term strategies and solutions to address that growing need. So progress on that front, but certainly still a ways out from, you know, being public with anything that we'll share as to here's what we think are going to be the best solutions moving forward. But I'm very hopeful. I mean, I feel like we're hitting some traction with some of the ideas that are coming to the table. The other thing I'll mention, and I think it is important for commissioners to be aware of, is the receding CARES funding that is going to be taking place in the next couple of months. So as you're probably all well aware, with the pandemic, there was a federal financial response greater than we've ever seen to help address the pandemic and a lot of the human services needs that were created because of it. A lot of that funding is either currently scheduled or anticipated to go away or normalize or claw back sometime in 2022. And so what we've been active trying to do is prepare our community for that inevitability. You know, there's families, and Kendra may touch on this as well. You know, there's families that have had an increased food budget, you know, increased food benefits for the last couple of years. All families that have been going to school for the last 2 years have been able to access school lunch for free. There used to be, and there will soon be, free and reduced lunch. There's qualifications for you know, free and reduced lunch. Housing, you know, Good Sam alone has helped keep 2,000 different households in their homes through rental assistance, community action agency, through utility assistance. So there's been a number of these benefits that have been available, and families have come to rely on those. Those are going away. And if I'm willing to guess, I don't think a lot of those households are thinking about the fact that those are going to be going away. But when they do, our community partners need to be prepared to respond. So what we have been doing is collecting and understanding what are those different funding sources, who's providing them, and then we're reaching out to organizations individually, food pantries, for example, and saying, hey, you know, you might want to stock up, you might want to prepare that you're going to have increased demand in the near future, talking to housing providers about that increased demand. So that when it does happen, you know, churches that they're thinking about, hey, people might be reaching out and asking for help at a greater level than they have been over the last, you know, year or so. So again, we're active in just preparing the community for that, but something I think is good for commissioners to be aware of as well.
Question, the homeless.
Yeah.
Maybe you don't know, but how many families in Ottawa County do you think there are right now that are homeless?
How many families?
Or individuals? I mean, whatever can works the best for you.
Kendra, can you answer that call or that question if you're listening?
Well, maybe. I haven't run the numbers real recently. Last time we ran the numbers was when we first started meeting with Patrick's group. And at that time, we had 268 individuals that had reported through our department that they listed themselves as homeless. So obviously that fluctuates pretty often. And we have a number of homeless individuals that are not willing to seek assistance with the department for a number of reasons. Maybe, you know, they just don't want the government involved in their life, don't want questions, things of that nature. So I would say that's a pretty good estimate though, because how people define homeless can be varied. You know, someone says that that's a transient individual. They might be couch surfing and maybe not actually living in a car or in a tent. So I would say that that's a pretty good number. I would probably would go with.
And I'll add to that. Our concern is the unsheltered homeless population right now. So, I mean, we have Gateway Mission, we have Love in Action, we've got Salvation Army in Grand Haven that meet the need, but there's this growing unsheltered. So to give you some unsheltered numbers, first quarter last year, Community Action House's street outreach team was working with 84 individuals. So in one quarter, 84 individuals that were unsheltered. That means they are outside in the community. This year, that number is 155. So you can see that growing increase. Now, most, if not all of those are individuals. I don't believe any of them are households, like
Okay,
couples
okay.
or kids.
Yeah, okay.
Most kids are being met by some community provider.
Okay, good. The last year before, I think in Holland, the east side by the expressway there was a camp there.
Yep.
Is that camp still functioning? Do you know, Patrick?
Kendra, again, you can probably take this, but that camp was cleared out to the
Yeah.
best of my understanding, right? So I don't think anyone has returned to that property.
I think they just moved further north.
Yeah, I mean, you're not solving the problem.
No,
You're
no,
displacing people to go
Yeah.
find a different place to go.
There's a camp along the Grand River.
Yeah, I knew that. I knew there's some.
Granville.
Yeah,
Mhm.
yeah, that I knew, but I was wondering about this camp in Howell, and I know what you said. They cleared it out, but they're gonna go someplace else.
Yep.
So, okay. Okay, thank you, Patrick. Any questions for Patrick? Okay, Kendra, I know you talk already, but you can fill in the rest of your story.
Okay, thank you. So I guess to piggyback on some of the things that Patrick had shared, we do not have any updates on Medicaid closures at this time. At first, it was alleged that it was going to be July. However, we have no information on even if or when it's going to be in September either. So right now, it's kind of at a standstill and at a hold. We do know that the monthly review for the assistance continue to be reviewed. And for July, it was extended again. So individuals that were receiving FAP benefits are continuing to receive maximum benefits. So that occurred again for July. And again, those are reviewed monthly, and we usually know during the beginning of the month. So unfortunately, that's not information that we can provide much sooner to individuals. And as Patrick said, our biggest concern is people preparing for that, as continuing to get education out that you don't have to use all of your benefits all within the month either. So if you're starting to extend your benefits longer into the next month, that might help you to sustain for a longer period of time. Some other things I wanted to update on was Ottawa County was chosen to be evaluated and reviewed for our access that we provide to clients in our lobby and out to our community partners. I'm very excited that we were chosen. I think we do a fantastic job here in Ottawa, and that includes some partnerships that we have in the community. One with the health department, with Pathways to Better Health. They'll actually be meeting with Sue Keen to be talking with her about what that looks like for access as a MyBiz navigator, and also with the Community Action House. We have done significant work with our Cuban refugee population with access that we have with bilingual staff. We have one individual staff that has taken on the Cuban refugees and has been meeting with them in the lobby, doing some fantastic work in partnership with Bethany Christian Services as we continue to see a large population of Cuban refugees coming into Ottawa. So appreciate all of the work that we have, and we have a great diverse staff that is able to provide assistance for our marginalized populations. Also our partnership with the health department as well for our migrants. We continue to get even overtime for our migrant staff to be assisting with vaccine clinics and testing continuing throughout the summer up and through September. So excited for that continued partnership and ability to reach out to our migrants in our community. And then lastly, on our child welfare side, my board, which two of them are actually appointed by the county, really wanted me to report out on some things that it sounds like might be information going out in the community that might not be 100% accurate. And so as I report out every year on our numbers for Child Protective Services and investigations, and then our removal numbers. And so I do that every year, but they said I probably should do that a little bit more often. So I wanted to share that in May, we had no removals. So no children were removed from their home in May, and only one child was removed in June. And that was actually a situation where a parent had a fatal illness and would be passing away. So during May and June, we didn't have any removals for child abuse and neglect, which is a huge kudos to my staff in the community for prevention efforts, for maintaining community supports, for looking at things with community mental health and other agencies to maintain kids and keep them stable in the community. This is not without a lot of work. Obviously, it takes a lot to maintain some of these cases that we have, especially with the increase, as Lynn had mentioned, with mental health needs, not only for the youth, but our families. But it sounds like there were some reports of lots of removals in Ottawa County, and I just wanted to squash that if that was a rumor that was getting out there, as I am very proud of 2 months only having one child removed. So that's thanks also to our court. There are times when we may petition to the court but decide not to remove, and the court obviously makes that decision. And so we are very appreciative of our partnership with our court, with our prosecutor's office, as we really do see child abuse and neglect as a priority in our community. And then lastly, I just wanted to give kudos also to our sheriff's department. We've had some very significant cases lately that have been in the media that have been very intense. And we really, truly appreciate the collaboration and the partnership that the sheriff's department has with us. I've obviously been in other counties, and just the communication we have and the collaboration is fantastic. And I just can't say enough about just the partnerships we have with all the county departments. I feel like we work well together, and I'm just very appreciative. So thank you so much. I don't know if you have any questions.
Any questions for Kendra? Okay, anybody else have anything, any other comments? Okay, now we're gonna go to public comment. Is there anybody out there that would like to speak? Okay, seeing none, make a motion to adjourn. All in favor, say aye.
Aye.